A lot of stuff was going on, but I wasn't, I was thinking, am I going to play sports again? I'm 10 hours away from home. How is this all going to work? All I wanted really was something to stick in my knee or something to make the pain go away.
It's one of those phone calls you hope you never get. My heart sunk. Mrs. Wehrman, Phil's been in an accident. The ambulance is on the way.
Well, Phil is from the St. Louis area. He was going to school at Auburn University, and he was out tubing with his friends, and I think he hit a bump or something in the water, and he ended up dislocating his knee, which essentially means that the shin bone was completely disarticulated from the thigh bone. And when you do that, you not only tear multiple ligaments in the knee that hold it together, but in his case, he also tore the main artery that goes down to the lower leg and the foot. And that obviously is a surgical emergency. Luckily, he was evacuated out of the area immediately, and he had reconstructive surgery on the artery just to save the leg, which is a miracle in itself.
Most people said this is not a typical injury. This is not something that you want to fool around with. You can't go to just any doctor. You really have to get the best. I pursued recommendations, decided that going to Barnes was the very best option because we needed to have people that were top-notch for his care. We were never disappointed. We went and they did a fabulous job.
He tore several ligaments in his knee. He did have the ligament reconstruction in order to address those. And then there was a lot of physical therapy afterwards. Phil worked diligently. His parents were very much involved with his care from day one. One of the things we talked about initially is that this is going to be a year-long process, and it truly was a year-long process.
It was, I think, especially comforting for Philip, being a very avid sports maniac, that we were going to a place where people were actively working with injuries which involved a lot of sports injuries, because those can be very specific.
As team physician for the St. Louis Blues or the St. Louis Rams, we find that the challenges of having them recover quickly and safely and getting them back on the field, those lessons that we learn in that arena can then be applied to the rest of the patients in our practice.
Even though we say it's sports medicine, what that covers really are most acute and many chronic injuries to the knee and shoulder for most patients, really from the age of 8 or 9 or 10 up to the age of 60 plus. It's really not an age-specific thing.
Well, from a surgical standpoint, the most common conditions I see are the torn cartilages in the knee or ligament tears. And these are very common sports medicine-related injuries that often result in surgery, although the vast majority of problems I see in the office probably don't even need surgery. They can be treated with non-operative means.
Vast majority of what I do with arthroscopic surgery, so the minimally invasive approach that we can do much of our surgery without having to make large incisions around the joint.
The procedures themselves were great and went off without a hitch. I've gotten back to doing things like running and cycling and things that I always used to enjoy. I have nothing but good things to say about our experience there with Dr. Matava at Barnes.
Well, I think probably the most rewarding time was when we walked in the last visit and he walked in and we saw the smile on Dr. Matava's face and the doctors, and they shook their head and said, "You shouldn't be doing what you're doing."
It's good to get back to doing things like that again and to being an athlete again, and something that at times they weren't sure if I was going to walk, if I was going to run. I think it's been better than they expected and better than I could have expected, and I'm really thankful for that. That's incredible.